The Professional Support Unit, the PSU. This presentation is an overview of the Professional Support Unit, what resources we can offer and how you can access them. The PSU provides free developmental support for resident doctors and dentists in London and Kent, Surrey, Sussex, from Foundation to CCT, to enable your progression in training and effective contribution to health service delivery in this region. We work through self-referral and are somewhere you can discuss issues in confidence and impartially away from the workplace. We see on average 1,500 doctors a year from the region who can access a variety of services. So who works for the PSU team? As you can see, our team is made up of both clinical and non-clinical specialists, including educators, coaches and linguistic experts, who often utilise a multidisciplinary team approach to meet your needs in service provision. We also currently commission expert neurodiversity partners to offer assessments and neurodivergent coaching where eligible. You'll also note that you won't be seeing anyone involved in your work, training or assessments, as we are separate from your training programme and your employer. So what are the common reasons why people may contact us at the PSU? The commonest challenges during training that can cause trainees to ask for our help are, firstly, repeat exam failure. Recurrent difficulties passing examinations is the commonest reason. Sometimes examinations may become a challenge for the first time in a higher medical training, or studying for exams can be part of an ongoing issue dating back to school and/or university. In addition, working long hours in busy jobs and having commitments outside work can add to the challenge. Sometimes not using the most productive revision approach can contribute. Unfamiliarity with exam technique may be an issue, particularly for international medical graduates, and performance anxiety may be another specific problem for some. Recurrent lack of success can create a vicious circle with loss of confidence and enjoyment of studying, making it more difficult to learn. Previously unrecognised dyslexia or other neurodiversity is something we always consider when residents report recurrent difficulties in passing exams. Professional relationships and communication issues. Relationships are another important reason for trainees seeking support, and often these relate to senior colleagues and especially issues around giving and receiving feedback. We work in a highly stressful environment in healthcare, with a lot of emotional pressures which can often lead to misunderstanding or misinterpretation and resultant behaviours. Risk and uncertainty, linguistic and cultural challenges can sometimes be an issue, especially for international medical graduates. Systemic issues are important, and there is a lot we can do to help each other through informal supervision and recognising when colleagues need support. Suspected neurodivergence. Although being neurodivergent can offer many strengths to being a clinician, the medical or dental training programme and environment can also offer challenges to many residents, particularly around exam preparation, interpersonal skills and executive function. We often see residents who may have managed well with work and training up to a certain point, but are now struggling, or they may always have suspected they were potentially neurodivergent due to challenges in certain areas, but have never been assessed. I will outline the PSU neurodivergent support in more detail later in this presentation. Mental health difficulties. Clinicians are not always good at seeking psychological help for themselves when it is needed, and fear of stigma and reluctance to consult colleagues may be important factors. Stress, burnout, anxiety and depression are relatively prevalent in healthcare professionals. Imposter feelings, perfectionism and guilt are all themes we often see described by our clients, which can impact on confidence and self-esteem. Life events impacting on training and work. As well as being clinicians in training, we're also human beings, and life events and pressures outside medicine such as ill health, bereavement, divorce, addiction and debt can also impact on well-being and self-confidence. Career changes and doubts. Career doubts are common and may include specialty choice, type of consultant role, or sometimes whether to continue medical training at all. Career doubts sometimes reflect underlying problems, and it is important to reflect very carefully before making irrevocable decisions that may be regretted later. Returning to work after long breaks. Returning to training after taking a break for maternity, paternity, additional training, academic study or ill health can raise many questions, doubts or fears, such as feeling unconfident in skill set and experience or changes in career planning priorities. Not uncommonly, clients apply with a mixture of several issues, and we always try to gain as full an understanding as possible of the whole picture before making suggestions for support. Often, we will find that it is a combination of these factors that lead clients to apply for our services. So what services can you access via the PSU? PSU offers 4 main areas of support to residents in training, which can be accessed individually or sequentially depending on your needs and priorities. And they are one-to-one support, workshops, group support, and self-directed learning modules. Firstly, turning to one-to-one support, I'm going to go through these in turn, but starting with the PSU Advisor Appointments and Guidance Service. This offers holistic triaging, conversations, initial assessment and signposting to relevant PSU and external services. We then have the PSU Coaching Service, which offers trusted, confidential, specialist and impartial virtual one-to-one support to trainees. Individuals typically present with multiple complex and diverse needs, which are negatively impacting on their performance and training progression. Common issues which trainees bring to coaching sessions include managing burnout, exam failure, challenges at significant transition points in training, for example transitions in returning to work, and impact of negative mindsets and limiting beliefs affecting confidence and performance, such as imposter feelings or perfectionism. Other personal and domestic factors can run in parallel, such as health and relationship challenges, which add complexity to the challenge and make the need for support even more urgent and complex. The coaching service also offers support to international medical graduates who may have little or no support or face challenges with navigating complex NHS systems and life in London. The Careers Unit offers guidance, advice and support for career decisions or doubts and key transition points such as choosing or switching specialties, developing a portfolio career, as well as preparation for registrar and consultant roles and interviews. Neurodiversity assessments and coaching are for difficulties related to exams and the workplace. Further information will be provided in the next slide. And then finally, the Specialist Linguistics and Communication Support Service. Common themes for this service include addressing challenges in communication with patients, colleagues and carers, skills for effective and confident communication, preparation for communication-based exams, developing English language for clinical practice and enhancing cultural competence. Challenging conversations can be modelled in a safe, supportive virtual environment similar to an OSCE, with developmental feedback given by specialist educators and linguists. More information can be found on the PSU link presented here. Moving on to workshops. PSU regularly deliver virtual half or full day workshops to resident doctors around core themes or challenges impacting on training or career progression, which complement the one-to-one service offer. Some key examples are a 3-session burnout series, which introduce you to the beginnings of a CBT-informed approach to spotting and addressing burnout through core themes such as perfectionism and boundary setting, and preparing for examinations, which cover areas such as time management, prioritization and procrastination, and mind management. We then have the group support offered particularly to those with dyslexia. The PSU runs an informal monthly online peer support group for dyslexic healthcare practitioners to connect and discuss any experiences, questions or concerns they have. Resident doctors or dentists can come along to any session when free. Information on how to sign up is on the workshop section of our website, which is listed later in this presentation. And then finally we have self-directed learning modules. The PSU has developed a range of 17 bite-sized virtual modules focusing on supporting key concerns or issues that can form a barrier to successful training progression for resident doctors and dentists, including assertiveness, personal and professional effectiveness, record keeping, and examination support. This slide is going to talk about how the PSU can support neurodiversity. Around 1 in 7 adults are neurodivergent, and historically healthcare practitioners lag behind in accessing assessments or speaking about their experiences. Thankfully, that situation is slowly starting to change with more aware and supportive workplaces and supervisors. We're increasingly seeing postgraduate learners who are highly capable or competent clinicians with a range of strengths and skills, but who struggle with some aspects of training due to possible neurodivergence. The PSU can fund a range of support for those who are or may be neurodivergent, including assessments, neurodivergence-focused coaching, peer support groups, and workshops. So when might it be worth considering neurodiversity? Characteristics of neurodivergence in the postgraduate training population do not always resemble those of neurodivergent children, and so it can easily be overlooked or discounted. Sometimes challenges only become obvious in later life when life becomes more complex, for example working longer hours, studying and managing complex relationships, or other responsibilities. It is sometimes when we are tired or most stretched that the characteristics start having an impact on our training progression. Whilst there is no definitive list and no two neurodivergent adults are the same, it may be worth considering neurodivergence if you have a cluster of characteristics or pattern of experiences which include the following. A mismatch between your range of strengths and skills versus challenges which others seem to navigate more easily. For example, you may be great with patients and in verbal communication, but struggle to complete your portfolio or admin tasks such as writing notes. Repeated exam failures. For example, you may struggle to focus during revision, remember information, misinterpret questions, process information quickly when under stress, or formulate your answers clearly. Executive function challenges, for example, time management, organisation, prioritisation, planning, getting tasks started, finishing tasks, or emotional regulation. Long-standing attention, focus, impulsivity challenges, for example, having deep periods of hyperfocus when the subject matter interests you, but be unable to maintain attention if you're not interested in the task. Information or language processing challenges, including writing, reading, memory, interpreting, or recall. Repeated interpersonal communication challenges. For example, if you find you're often missing the context or nuance of conversations, or misinterpret what others have said or why they may have acted in a certain way, resulting in challenging relationships or feedback. Sensory or environmental challenges. For example, being unable to focus because of the sensation of clothes on your skin, background noise, which others may not even notice, or light in the room or smells. And finally, a sense of always having had put on a mask to fit in, often from a young age having observed others to see how they navigate social situations and then trying to copy their actions. So on this slide, I'm going to talk about PSU neurodiversity assessments. We may be able to fund an assessment for neurodivergence if you have a persistent experience and or cluster of characteristics, being strengths and challenges suggestive of neurodivergence, and you are struggling with progression in training or work as a result of these experiences, and assessment is likely to help in some way. We don't have a routine clinical ADHD or autism assessment service. And in most cases, our neurodivergence assessments report will enable you to access adjustments or accommodations from college exam boards or at work if you would like it, and additional support such as coaching. Psychological support. Unfortunately, burnout and other psychological conditions such as anxiety and depression can be common to doctors and dentists, but not surprising working in stressful and emotionally challenging environments such as the NHS. There are a number of doctor and dentist specific as well as general resources that can be accessed to support your emotional health and well-being whilst in training, listed here. NHS Practitioner Health provides a free confidential psychological health service for doctors and dentists, separate to mainstream NHS services, which can be accessed by self-referral using the link on this slide. The PSU also offers a number of wellbeing resources, including videos, podcasts and exercises on its Wellbeing Hub as listed. The Supported Return to Training Programme. The London Supported Return to Training Programme is aligned to the PSU and aims to support all resident doctors to safely and confidently return to training after a sustained period of absence. The programme applies to all resident doctors absent for 3 months or more, regardless of the reason. All PSU services can continue to be accessed during periods out of training if a current London KSS training number is still held. As returning resident doctors are a diverse group, Supported Return to Training aims to provide a bespoke, individualised package for each returning trainee, rather than a single one-size-fits-all approach. This includes a menu of options that can be built into an individualised return to training package, agreed between a trainee and their educational supervisor, which can include one-to-one PSU coaching and workshops. The team can be contacted using the link on this page. So it's also useful to consider what services the PSU can't offer resident doctors and dentists. As stated here, we do not offer representation, advice or guidance on any work disagreement, legal contracts, occupational health or financial issues you may be managing. But we can speak with you to explore how you might access support and signpost to relevant organisations such as the BMA reps or Freedom to Speak Up guardians. So finally, how can you access the PSU and find out more about us? Further information about all our services can be found on the Professional Development page under the Professional Support Unit tab or by simply clicking on the QR code on this slide. If you are unsure which PSU services may best support you, please apply through the PSU link here and we will assess your application and either make direct referrals on your behalf or invite you to a triage conversation to allow space to understand more context and content of any current challenges you may have linked to your training, to agree appropriate support with you. This now concludes this short overview of the PSU, and we wish you every success with your ongoing training.